Good afternoon and welcome to my presentation titled Data Developments in Staff Incident Management, Recognising Risk to Initiate Change. Our world is changing at a rapid pace, and the changes we are seeing in the technology we are using in patient care never ceases to amaze me. The same could easily be said for changes in how we manage and manipulate our data, and in healthcare we have a lot of data, both for our patients and our staff. As the manager of the medical unit of our hospital and a member of our organisational leadership team, I have prepared this presentation for the consideration of the board regarding recommended improvements in data management within the hospital, particularly relating to bullying complaints. The presentation will provide background on current data management practices regarding bullying complaints, highlight concerns that have been identified regarding current process, and recommend improvements for the future. As a manager, I have identified the number of workplace bullying incidents has been increasing in our organisation in recent months, and I find this to be alarming given the focus we put on promoting our organisational values and standards of behaviour, and our zero tolerance policy regarding workplace bullying. After speaking with members of the Human Resources team, when this increase came to my attention, it became apparent that our current processes for incident recording and reporting may be influencing this result, and may not be presenting the most accurate picture of our organisational environment. While we have an electronic risk management system known as RiskMan, which is designed for incident reporting and recording, the current data regarding workplace bullying incidents is collected by hand by the HR department from face-to-face discussions with staff, and then entered into a Microsoft Excel spreadsheet at the end of the week. This method of data collection is difficult to understand and draw analysis from, as such, requires further consideration and review to ensure we are receiving and appropriately actioning the most efficient, timely, and accurate information in regard to this sensitive and serious workplace issue. We live in an age where information technology has been radically transformed by digital technology, and this has changed and shaped how we communicate and share information. The volume of data that we work with in a healthcare setting has increased dramatically over time, and this will continue as further technological advancements are made to assist with service delivery. Healthcare has reaped many benefits of technological evolution, from the days of paper-based records and systems to the introduction of big data, and to even more recently the introduction of electronic health records. And these include increased efficiency, well-informed decision-making, reduced errors, more timely decision-making, improved diagnostics, and overall improved patient outcomes. It's important to keep in mind that while we are embracing these digital enhancements to improve how we gather, store, analyse, and report on the patient and risk data, we should also be using them for the management of our human resource data, including the management of staff incidents and complaints, to benefit from these improvements that are available to us and better manage our workforce. As part of our technological evolution, our organisation introduced an electronic risk management system to more efficiently and effectively manage patient incidents, risks, and complaints. While this system is clinically based, it is also designed to capture and store the same information from a workplace health and safety and also a HR perspective. Currently within our organisation, patient incidents, risks, and hazards and complaints are all recorded, investigated, and managed and reported in this RiskMan system. However, staff incidents and complaints regarding workplace bullying are not, and currently involve the face-to-face reporting and gathering of data, which is transcribed into an electronic Excel template, which is stored on a server and not recorded in RiskMan. From feedback provided by the Director of Human Resources and Engagement and the HR team members, it is apparent that the main strengths of the current system and processes, and the main reason that it has remained unchanged, is the lack of data security and ability to maintain confidentiality in RiskMan due to the system's current structure for user access. When the current structure of the RiskMan system is examined, it shows that if a bullying complaint is entered, a minimum of 12 staff will be alerted to and have access to the information contained within that complaint and/or incident, and this includes the CEO, the entire executive management team, quality services team, the report writers, health and safety officer, systems administrator for RiskMan, and selected members of the human resources team. Due to the access provisioning within the system, this cannot be changed, and as such, even if one of these team members was to be the person to be complained about or being investigated for such behaviour, they would be alerted to the incident and its details. Under the current arrangements, the HR team can keep the incident information confidential and secure, and only release information as necessary and appropriate to investigate and action the matter. The main shortcomings of the current system are the manual nature of the data collection and recording, difficulty in capturing the data in a timely manner, and the opportunity for personal bias and human error. The data analysis is difficult in its current format as it's collected via discussion notes and transcribed into an Excel spreadsheet. As many nursing and environmental staff work many and varied shifts, including night shifts and weekends, and the HR team work Monday to Friday, 8 till 5, being able to make time to meet with a HR team member to discuss an incident or lodge a complaint could prove quite challenging. In addition to this, speaking up to another person about such a potentially controversial and sensitive matter as workplace bullying may discourage reporting and distort the actual number of incidents that take place. The Riskman system has been in place within the organisation in its current form for 6 years, and to date there have been no plans to change the system or current system structure. However, in 2017 it was announced that Riskman International would be integrating with RL Datix, and this organisation would be taking over the delivery and management of the Riskman system in time. RL Datix is a combination of RL Datix and Riskman International, and their organisational mission is a world where patients have access to the best and safest care possible. As neither the hospital nor RL Datix have put a time frame on the transition of the old system to the new look system under the new provider, it is not planned in the short-term future. However, I recommend that this current position be reviewed by the board due to the shortcomings of the current Riskman system in the area of workplace bullying and HR incident management, and the opportunity to move away from the current manual incident management system within the HR department. There are many benefits to be experienced by transitioning to and from the current Riskman system to the new RL Datix system, and these include increased accessibility for users, improved system customization to meet user needs, and also improved reporting. RL Datix has many features and enhancements over and above the current Riskman suite, including investigation tools with the ability to set specialised and flexible workflows to support several frameworks and investigation types. This would address the current concerns with access and confidentiality of incident reports. And this feature also enables questions to be built into the investigation process to increase availability of required information, reduce rework through follow-up, ensure consistency between different investigations, and also fulfill our mandatory reporting requirements. Under this framework, staff would enter the incident or complaint information personally and directly into the system. So this would ensure reduced potential for personal social bias on behalf of the person preparing the notes. And another improvement with the transition to RL Datix would be the accessibility and ease for staff to record incident and complaint details in the system directly without having to make an appointment and then sit through a meeting with a member of the HR team. As long as the staff have been trained effectively in the use of the system, RL Datix could be accessed from a PC, a tablet, or a mobile phone, ensuring timely recording of information in a less confronting setting than speaking with a representative from HR. RL Datix has extensive reporting tools and functionality, which is far superior to Riskman, and would offer reports to trend incident frequency and severity, determine associated costs, and support financial tracking. This system also allows for the development of customizable dashboards, which would provide timely graphical information to managers and HR team members to identify trends against incident and complaint data. With the identified benefits and the improved data analytics and reporting functions of the new system, risk and compliance issues can be identified and actioned in a more timely manner. This time factor is key to assist HR in the management of risk resulting from workplace bullying incidents, as issues can be investigated and dealt with promptly and professionally, reducing the risk of further complaints or escalation of complaints to external bodies for further action. As the current arrangements for workplace bullying incidents is a purely manual process, the transition to RL-DATIX would save significant time for the HR team and management in compiling and revisiting old data each month when reporting on incidents. From discussions with the Senior Manager of Clinical Governance, who is the System Manager of RiskMan, RL-DATIX has indicated a transition to RL-DATIX from RiskMan will be at no cost to the organisation, other than staff time in transferring data and configuring the new system, and training staff in its use. While this appears inexpensive on the surface, significant man-hours would need to go into this project, and this would need to be explored further and factored into the decision of the board regarding this matter. With regard to comparing the existing data once the new data management system was introduced, I would highly recommend reporting on both for a period of 12 months to contrast and compare results. Given the historical data would still be available, it would be valuable to trend the current month against the same month in the previous year to determine if the number of incidents and location of incidents is consistent or has changed significantly with the change in system. As our health systems and human resource systems evolve, the technology that we use to manage our data should also be evolving. And while we move to an electronic-based system for the recording and management of workplace bullying incidents and complaints may appear on the surface to be time-consuming and costly in the short term, the medium and long-term benefits well outweigh this. In today's workplace, we have the most information at our fingertips, so why should our important HR data be any different? Transitioning the management of our workplace bullying complaints to our current risk management system, once it's undergone the proposed upgrade, will ensure more accurate data, more effective analysis and reporting, increased data security, and also more timely decision making in relation to an important risk to the health and safety of our employees. With our staff wages making up over 75% of our organisational expenses every year, and knowing that happy and engaged staff provide better care, when we have this technology available to us now, it seems remiss of us to not be using it to take advantage of the benefits and better manage this aspect of our operations. Thank you for listening to this presentation. I hope you found it informative and useful in considering the proposed changes in our current data management system. Thank you. Welcome to my presentation.